All right, got a lot to talk about
All
this
right,
morning,
I'm
so
ready.
I'm gonna get to it. So the title is Nutritional and Medical Food Therapies for Diabetic Retinopathy and Macular Degeneration. So let me just say, taking supplements for stuff.
Okay.
So I like to keep it simple. I'm not a smart guy. I just try really hard and I rhyme with a lot of things in order to remember stuff. So think of your body as simply a recipe. Okay. There's a meal. Your body is a meal. And so you have to go and say, there is a perfect meal out there, which is the best meal in the world, and it's possible. But since we don't have that perfect meal, we all fall short in the taste of the meal, the quality of the meal, the outcome of that effort to have these raw materials called fruits and vegetables and salt and pepper and in a kitchen, in the utensils, and whether you're at the Denver, Colorado, where it takes longer to boil the water, all the environmental toxins, all the stuff that goes into this meal. So we have this meal, and we have this biochemistry to us. We're made of stuff. So we've seen the cooking shows where they give the same stuff to 5 different people, and somebody wins the cooking show and somebody loses the cooking show, and that, the Hell's Kitchen guy is screaming at him or whatever it is.
Yeah.
Okay, so we are made of stuff. And so our baskets are actually not equal. And it's not fair that we don't have access to the same stuff to make ourselves out of. We either don't have it because we can't afford it, we're living in the wrong place in the earth, it's not available to us, or what we choose to put in our baskets, where we shop, what we buy, is indicative of what we're going to make. So we have stuff, and then we have to go make stuff. And we have a recipe. There's this DNA that we have. And so if we all have the exact same recipe card, we can be more close to making the same stuff, but we don't. Because our DNA, the words that say, boil it for this long, add this, do that, is all written a little different. Some of us have missing recipe aspects. It's kind of like that CIA document that's all blacked out and you can't read part of it, and you have to guess. And so it's not fair that we don't have it, but that's the way it works. Sometimes you can work around these things. If you find out that you're missing part of your recipe page, you can say, you know what? I need to go wing it. I need to go do some things that will. Sorry, that was me. I was looking for a timer, and I need to go wing it so that oh, good Lord. So I can make the right recipe. So we're a recipe. The other thing is our brain is the one brain that we have, but we actually have 2. We have our gut. And people don't realize that we have a gut-brain axis, and we have to respect our gut as much as we do our brain. We have more bacteria in our body, bacteria cells, than we have human cells in our body. We have trillions of bacteria in us. And just like you might have a dog that you want to feed and walk and exercise and take care of that pet, whatever it is, do you take care of your pets? Do you take care of your bacteria? Do you treat them well? And that's this whole gut dysbiosis or not working well. And do you take probiotics and prebiotics? And do you do these things to have the right environment there? And our eye is brain tissue, okay? You and your wife have a child. It is your child. Okay, it came from you. Your eyes came from your brain when they're developing. They kind of move out, okay, to where you can see them outside when you open your eyes. And they're not respected as being part of the brain. So what goes on in the brain goes on.
I have never heard anybody say that until you did.
Well, it's true. When your eyes are part of your diencephalon, it's brain tissue. It just, you can see it. And so it's not respected. And we complain about trash on the side of the road, but if you drain the York River and saw how much trash is at the bottom of the York River, you go, oh my God, we're pigs. Yeah. Okay, so eyes are brain tissue. So let's talk about these nutraceutical stuff. And I am a blood vessel guy. The biggest oxygen pig in the body is the retina. No more amount of oxygen is needed and blood flow occurs per unit volume than there is in the back of the eye. The eye is constantly replacing cells. And so if we have bad blood, if we have bad oxygen, poor oxygen, then it's going to hurt our eyes quicker than it's going to hurt our elbow. Okay. And so I'm sitting here all the time looking at these eye diseases. People come to me, and I've said this before. No one's ever come to my exam room in 30 some years and said, I'm glad I'm half blind. Nobody does. Now, it's implied that I'm supposed to do a good job and help them. And so my job is to sit here as quickly as I can and start finding out if I have an audience who wants to listen or not. And they come in, they go, Mom has diabetic retinopathy, or Dad had macular degeneration, or I have this and whatnot. So my job is to try to help you come out with the best recipe for your body.
Within the parameters that the patient sets.
And you can go to cooking class, okay? You can choose to change the way you cook, okay? You can buy better ingredients. You can choose to have, look at that basket of rotten vegetables versus good vegetables, and you know what the outcome's going to be. So eat good vegetables. So in terms of this stuff, okay, so we have nitric oxide in our body. Nitric oxide dilates our blood vessels. We want that. We have these mitochondria, these powerhouses in our body. You want them to work well. You have a choice of getting 2 miles at a gallon or 36 miles at a gallon. And which one do you want? You say, well, 36. Well, then you got to go do things that helps your mitochondria achieve that. We have recipe problems. They're called genetic SNPs, or single nucleotide polymorphisms. So that's the missing part of the recipe, that you don't get to make that stuff that's supposed to happen. And so you can work around it. So you can go identify what those things are, genetic studies, or you can kind of surmise what they are, because when you have that problem, it's usually from this. You don't have, for instance, you don't have to go test somebody with Down syndrome to know they have trisomy 21, because you know what it looks like. And so you don't have to go do all this testing on everybody when they have certain diseases, because you know what they kind of look like. So we have these vitamins. People take they go, and it's half of America takes nutraceuticals of some way, shape, or form. And so you have to take the good stuff and not the bad stuff. And there's a lot of bad stuff in some of these vitamins and minerals, and there's good stuff. So you want the FDA, unfortunately, overlooking your shoulder to see that things are done properly. And you want studies done on things to prove that that's really true, because we know we can be led down the primrose path and lied to and sold a bill of goods. So I like to use this stuff called ocufolin, which has gone through all these FDA oversight, and papers are proven to show that it works. So, yes.
I always say, and I have been taught, and you can tell me fact or fiction, just like the ear cleaning, that before you buy a supplement to take, you should check with either A, your doctor, or B, your pharmacist, so that your pharmacist can look at your list of prescriptions that you may be taking to see if that supplement will help or detract from something that you're taking. And you should check with your doctor, who can tell you.
That is true, and I'll put a caveat in there. Now, there's an argument out there it's just a bunch of expensive pee. When you take your vitamins and it comes out yellow because of a component in there. But every doctor, healthcare provider, advocate of your health is going to want their grandchild to eat the best possible food they can.
Right.
They're 6-month-old.
Right.
And so we don't have access to that stuff. So yes, the best thing you can do before you do any supplementation is eat real food. Real food. If it grows, swims, runs, or flies and isn't poisonous, you can have it, pretty much. And so the number one thing is just eat real food, not processed food, not full of this, that, and the other thing. And we eat too much, too wrong, and too often. And so if you cut that down, then you're going to be healthier, because the oldest people who are healthy on this earth are poor people who live at the base of mountains, which means that they don't eat much, but when they do, they eat good quality food full of minerals. Okay, so to our text, okay? So vitamins, got vitamin A, carotenoids. So we have fat-soluble stuff, and so when you see something's fat-soluble, that means that you need to have fat not on your body, but in your gut. so that it dissolves and it is absorbed. So if you're somebody who doesn't eat until noon and you have a supplement that's fat soluble, vitamins A, C, and D, then wait till noon to take them because that's when your body's going to better absorb it. So we have these things called, we talk about antioxidants all the time.
Right.
And so my quick visual for people is you got a kid with a ball and somebody steals the ball from the kid and he's screaming, "Ah, I want my ball back." So the kid had the ball taken. The ball's an electron and he's screaming. So he's momentarily a free radical. And so somebody else comes along, shut that kid up, and it says, give him another ball. And now that's an antioxidant. So when you have molecules that have electrons stolen from them or the ball taken from them, bad things happen. They have these valence electrons that are unpaired and they can do some harmful things. And so we're constantly taking this ball away from this kid or molecule and somebody's giving it back to them, a different ball, but electrons. So we're passing electrons around all the time. So you go, okay, I get it. Okay, so we have to oxidize and we have to reduce.
What about
this
probiotics?
redox. No. Now you're in the gut. I'm just talking about these terms that people don't understand about why they're doing it. You have to have that kid, visualize a kid with a ball that's taken from him. He screams and yells and somebody else gives him a ball back. And that ball is an electron, okay? So we have oxidation and reduction. And that process, that dance is going around trillions of times a second all day long in all these cells in our body. So we have vitamin A, which helps with these things. You have these growth factors, these brain growth factors, these neurotrophic growth factors, and BDNF, brain-derived neurotrophic factor, growth factor. And so you want to take your vitamin A, okay? And then we have lutein and zeaxanthin, big ones for the eye doctor and big ones for the body, because they're huge antioxidants. They help the body out. And a lot of people, all the macular degeneration formulas, the AREDS2 study, AREDS2, they have lutein and zeaxanthin in there because the first one had this stuff called beta carotene and it caused problems for smokers. And so you want to go...
What kind of problems?
Cause lung cancer, increased incidence of some things because of the recipe, because of the dance. And so you have this vitamin A, these carotenoids, lutein, zeaxanthin, and they're helpful, and they're in these formulas that an eye doctor would tell you to take. But remember, eye tissue is brain tissue. As you treat eyes, you treat brain, and as you treat in the whole rest of the body, we're all connected. And then you have your B vitamins, okay? B vitamins, folks, think about taking B vitamins earlier in the day because they give you energy. They help your mitochondria out. But these are water-soluble vitamins, so you can take them whenever. But take them before, you don't take them and try to go to bed because they can make you alert. And then of all these different B vitamins, and the B vitamins in this, think of a watch, okay? You have a watch that has one, you open it up, you go, wow, look at all these gears. And all it takes is one little gear to be off for your time to be off. Now, if your gears don't work at all, you're dead, okay? Nothing works, okay? But depending upon which gears are off in your watch, your biochemistry, your recipe, your body, you're going to have bigger negative outcomes of timekeeping or life. And so the B vitamins are very important in order to keep your gears greased and make them work. Sometimes you have recipe problems where you just don't have that gear and it doesn't work well at all. And then when that happens, you've got to you got to replace the gear. You got to replace what that gear makes the outcome. And the B vitamins help do that. B1 is thiamine, and thiamine helps protect the blood vessels. Back to blood vessels, their blood vessels are supposed to dilate and contract. And so if I have $1, you can't live off 1% of $1, which is a penny, but you can live off of 1% of $1 trillion pretty easily. So if you have lots of blood vessels in your body, and a 1% reduction or improvement in vasodilation is like 1% of $1 trillion. It means a lot. And so when people smoke and they ruin their blood vessels, when people have, these trans fatty, high fatty diets and it ruins the inside, the quality of the rubberiness of their blood vessels, then they have these negative outcomes. And you don't get the blood in, you don't get the blood out, you don't get the amount of the income and outcome of the tide, the blood that brings in the oxygen and takes out the bad stuff. So B vitamins are helpful there. So thiamine is B1. B2, Adam took a rib was taken from Adam and given to Eve. So there's 2 ribs involved here. B2 is riboflavin, riboflavin, and it's helpful with this mitochondria, this energy metabolism, and it helps with the gears. There's this stuff when you eat spinach. Green spinach doesn't go to the tip of your finger. Your body, you gotta sit here, you gotta chew it, you gotta break it down, it's gotta get to your gut's gotta work, your acid's gotta be right. And then what happens when it's all broken down, there are these little guys with shopping carts. And I can see we're going to have to talk another time. And there's a putting together with the recipe of these components of that spinach, so that you can now go have the positive outcomes in the right recipe from that. So B2 is riboflavin, B3 is niacin, flushing and whatnot. And niacin you got to be careful with. B6 is this peroxidine, and you want to have this stuff in the right form. And there's good ways and bad ways, and I'm going to touch on this. So I'll come back next time and continue talking about this.
Peroxidine makes me think that peroxide has something to do.
No,
with it.
No.
I'm just taking a guess here.
And B7 is going to be your biotin. Think of hair when people have hair loss; they're doing that, and then.
There's all these different vitamins. I've never heard of some of those.
B9 is folate, and real quickly, you want to take methylfolate and not folic acid. It's the preferred form of it. B12 is cobalamin, and you don't want to take cyanide cobalamin or cyanocobalamin. You want to take methylcobalamin. But I see you're touching your watch here, so what I'm going to do is pick this up. Are we short on time?
We'll start with vitamin C's next time.
Well,
are there more B's?
There's to be or not to be. That's the question.
You didn't do that. You did not do that.
Yes, A2, Brutus. So I don't want to stab you in the back. So we'll do a better job on the B's and pick up from there, and hopefully the same listeners won't have to hear about the kid and the ball.
Okay.
But it all makes sense. You go, that kind of makes sense. And so we need to get the right stuff made properly and respect our bodies. Just think of the shopping cart. Think of, one quick thing is I'll tell somebody, say, you're in charge of your 6-month-old grandbaby and you got them for a week because they're whatever. Would you give them a Coke or a donut? You go, no, I would never do that. Then why do you give it to the 6-year-old or the 26-year-old? And so we're made of stuff.
Do you eat Oreos?
We've talked about this before. I'm teaching, I'm not preaching. Don't you ever go look at me. I try to be good. Talk to my staff. Stuff comes in out of the office. I have a rule. I don't want to smell it. I don't want to see it. You're not allowed to bring junk in my office and have it in the front lab. And because that's not who we are, that's not what I am. Try not to be, okay? So, again, don't ever go look at me and say, look at you.
Do you dunk them or do you bite them and then take the drink of it?
I pretty much don't.